Hello, I'm Dr. Jonnae Atkinson. I'm a family medicine physician with Baylor College of Medicine. But today, I'm speaking to you as co-president of the Mary Susan Moore Medical Society. In an effort to address the COVID-19 pandemic in the African American community, Mary Susan Moore has created a series of videos. This video will focus on an interview with a COVID-19 positive patient. Ms. Bishop will be joining us today to answer a few questions about her COVID-19 experience. Ms. Bishop is a registered nurse who works in the Texas Medical Center. Ms. Bishop, thank you for joining me today. I want to ask you a few questions that will provide our viewers with the idea of what it's like to have COVID-19 infection. I will start with this question. We know that the symptoms of COVID-19 can vary. What did it feel like when you had COVID-19 infection?
When I developed symptoms for COVID-19, my initial symptoms were a low-grade fever. I initially took my temperature and it was 100.8, and so I was a little surprised because with everything going on in the community, I think I kind of went into a little bit of shock. So I waited about 30 minutes and I took my temperature again. I didn't associate the initial symptoms before the fever with COVID-19. So the night before that, I had a lot of fatigue and a really bad headache, but I thought that it was related to stress, and we had just moved, so I thought it was related to the move. After I had the fever, I could tell that I was febrile because I started to feel sweaty, and then I started with chills, and it was intermittent fever and chills for about 3 days. I also had some significant GI symptoms that made it to where I couldn't eat well for about 3 or 4 days, but I took my mom's recommendation and my physician's recommendations and remained to stay hydrated. I also lost my taste and smell, which I can kind of taste now, but the sense of smell has never fully recovered. And so I'm about 4 weeks out now. And then I also had intermittent chest tightness. Just without exertion, I'd be laying in the bed and my chest would just start to feel tight. I never experienced any significant shortness of breath, but the chest tightness was very scary, and it was significant.
The next question is, what was the worst thing about having COVID-19 infection?
The worst thing about having COVID-19 was the unknown. This is a novel virus, and there's so much that people are learning every single day. I never knew how my symptoms would progress. So I was nervous about what was going to be the next symptom that would present itself. I have asthma, and I didn't want to have to go into the hospital and be hooked up to a ventilator. So just the unknown, I think, was the scariest part. And so I literally had to take it day by day.
And finally, how has the COVID-19 infection impacted your life?
The COVID-19 infection has impacted my life in regards to, I really truly understand the seriousness of the disease. It's not that I didn't understand the seriousness of the disease prior to that. Working in the healthcare environment, you see the impact that this disease is having on your community. However, experiencing it firsthand was extremely interesting and very scary. We weren't 100% sure where we got it from, and we felt like, and the reason why I say we is because my husband also became COVID-19 positive. We took every precaution that we could take. We stayed away from crowds. We sprayed down all of any packages that came to our house. We rarely went to the grocery store. We kept our kids isolated as well. So we were in shock basically when we came up positive. So I think that the impact has significantly caused me some, I won't say anxiety, but very much so aware. Like, I don't go anywhere without a mask. I didn't before, but I really do not go anywhere without a mask. As a matter of fact, I really don't go anywhere at all because you just never know. And they're starting to learn more and more about the disease, like whether or not it's airborne, how it's transmitted, how long it can live on certain surfaces. So it really makes you feel like you have a heightened awareness, and I don't want to catch it again. because now they're starting to find out that the antibodies only last for a short period of time. And so then at that point, you're at risk of contracting the disease again. So I think that more so than anything, it's caused me to have a very much so heightened awareness.
Thank you for taking the time to share your experience with us today. We are glad that you are on the road to recovery, and we wish you and your family a healthy future. For more information about COVID-19, you can visit reliable websites like the cdc.gov or your local health department website. To learn more about the Mary Susan Moore Medical Society or to make a tax-deductible donation to our community outreach efforts, please go to MarySusanMooreMedicalSociety.org. Thank you.